Hello everyone, and thanks for joining me. Today is Monday, March 29th, and there's some news out of Canada regarding the AstraZeneca vaccine that I need to share with you. This news comes as Canada is now in its third wave of COVID-19. COVID-19 cases in Canada are now rising rapidly in almost all areas of Canada, with the exception of the territories and the Maritime and Atlantic provinces. This all comes at a time when we are seeing the variants of the SARS-CoV-2 virus rise rapidly in Canada, and so this is all very concerning. Let's have a look at the news that is coming out today.
Okay, hello. My apologies, this is not the best camera quality. I could not get my other web camera working, but that should not interfere with the content. So let's get on with this today. So NACI is the National Advisory Committee on Immunizations in Canada. They are part of the regulatory process in Canada for the approval of vaccinations, and Health Canada approves vaccinations, and then NACI will make recommendations on the use of these vaccines. And then what happens is each province gets to make a decision based on their population and their needs as to how they will use these vaccines. And so NACI today is going to recommend that all provinces suspend the Oxford AstraZeneca vaccine to anyone under the age of 55. This has very significant ramifications. Here in my province of British Columbia, in pharmacies, we were going to be rolling this out to individuals under 55 in April, which is just a few days away. So this has big significance here in Canada. So this morning, Prince Edward Island announced the delivery of vaccines in pharmacies would be suspended, and further deliveries of these vaccines would also be suspended. So that raised some suspicion as to why are they doing this, and is there going to be something else happening here? And we are just waiting for further clarification on this. So Prince Edward Island was vaccinating those ages 18 to 29 with the AstraZeneca vaccine in pharmacies, and all of those appointments have now been canceled. They will not be moving forward, and so this will also delay Canada's vaccine rollout even further. We were to receive 1.5 million doses of AstraZeneca from the USA tomorrow. So just to catch up here, last week the European Medicines Agency, after review, found that the vaccine is not linked to an overall increase in blood clots, but they did say that they could not definitively rule out a link between the vaccine and rare types of clots. So that's a little bit confusing, and then we know that the NHS also reported some information that was a little bit controversial in response to that. So the concerns with the AstraZeneca vaccine, this is a viral vector vaccine. So they've taken a chimpanzee adenovirus, they've removed the genetic information inside, and they've placed genetic information for the spike protein. And when that vaccine goes into the body, it cleaves with a cell just like a regular virus would do, and it injects or inserts the genetic material that is necessary to make the spike protein, and then the cell makes the spike protein. This is what viruses do, but the difference here is that the spike protein itself cannot cause illness, and the chimpanzee adenovirus vector would also not cause illness. So it's different in that it will stimulate the body to produce antibodies and protect in that way, if you're not familiar. And I've also done a video on the AstraZeneca vaccine, clearly outlines how this all works. So I'll put a link up here to that video, and you can check it out if you want to hear about that a little bit further in more detail. So the concerns here are regarding cerebral venous sinus thrombosis. This is the more serious blood clotting that has been observed in some people following vaccination with AstraZeneca. I want to reinforce that this is very, very rare. I believe as of today, there have been about 30 cases in, I think, 20 million vaccinations in Europe. Very rare, but also very serious. This is much more common in women than in men. And like I said, 30 cases observed so far, but 15 deaths. And I don't think it is clear that these are directly related. They are being investigated. It could be that they are, it could be that they are not. We're still waiting to hear that. Most cases occurring within 14 days of receiving the vaccine, and the majority are in women. Now, it sounds like there all now have been reports of blood clots in younger women in other places in the world, but the details of that have not yet been released. So, like I said earlier, the US Data Safety Monitoring Board raised concerns last week that outdated information may have been reported by the company when it released these trials. So this was also a red flag that happened last week. Now, something interesting out of Germany, there is a group of researchers there led by this German clotting specialist, Andreas Granacher, excuse my pronunciation. And he has been studying these clots. And what is happening is it's not just the sinus cerebral vein thrombosis that they're seeing. They are seeing people if it's not caught early, this turns into widespread blood clots, low platelet counts, and sometimes bleeding even externally. And so he has studied a group of patients that this has been observed in who have received the AstraZeneca vaccine. And he's saying that this is something similar to what they see very rarely, but sometimes with a blood thinner called heparin. So heparin is a blood thinner that is often given after more invasive surgeries, like maybe a knee replacement or a hip replacement. I've dispensed it quite often. I've never seen a patient with any kind of side effect from it, but we know that these very rare events do sometimes happen. And so this event is called heparin-induced thrombocytopenia. And he's recommending that, he's saying that there is a way to diagnose this, to catch it early, and to treat it. And so he has developed a recommendation on how to assess patients who might have this, how to warn patients for different signs that this could be happening, and I'm going to go over that with you, and then how to treat it. We do have treatment for this. So if you've had the AstraZeneca vaccine, do not despair. There is treatment, and this is very, very, very rare, okay? And I'm going to show you how to look for any signs as well that this could be occurring. So we know what to do, how to diagnose it, and how to treat it, he says. And he has called this a prothrombotic cytopenic disorder. And the study that he has done, this is the title of the study, and if you want to read it, it's quite detailed, but it does outline the different patients that he saw, and you can have a look at that right here, and I will give the link to you in the description for the video. What are some other causes of blood clots? I thought this was significant to discuss. So blood clots are not uncommon. It is known that 1 or 2 people per 2,000 people every year will develop some type of blood clot. In COVID-19, it's even more common. So someone who's been diagnosed with the SARS-CoV-2 virus, or even not diagnosed, it's about 1 in 50 people will develop a blood clot. If you are hospitalized, you would be hospitalized because you have a more severe disease or presentation of COVID-19. So that goes up to 1 in 20 people. So the risk of a blood clot at that point increases dramatically. And at this point, the chances of developing a blood clot with the Oxford AstraZeneca vaccine are about 1 in 250,000 to 1 in 500,000. That is as of today's date at noon when I'm recording this. And so if that is going to change much, I do not know. I don't expect it's going to change too much, but I should not make predictions. Other types of viruses and infectious diseases also cause blood clots. And even the regular influenza virus does increase chances of heart attacks and strokes And it's because of this inflammatory process that influenza and other viruses and other infectious diseases do cause. So we do always run the risk of a blood clot with any type of infectious disease, viral disease, and there are some medications even where there is risk of blood clots, sometimes even regular birth control, oral birth control being one of them. So some symptoms of blood clots would be chest pain, lightheadedness. Some people will feel out of breath. They could have some soreness or swelling or even coldness, so a temperature change in their arms or their legs, unexplained bruises or small red spots that go away. And if you put a glass up to them, they don't disappear. So that's one way to test for that. Or signs of stroke. And the signs of stroke, I'm going to go over quickly with you because regardless, it's always good to remember this. Signs of stroke would include sudden numbness or weakness in the face, sudden confusion or trouble speaking, difficulty understanding speech, sudden trouble seeing in one or both eyes, or trouble walking, dizziness, loss of balance, or lack of coordination. So these are signs to watch out for. They could be signs of a stroke. And we know that a stroke is a blood clot. So this is an easy way to recognize a stroke. This is from the Heart and Stroke Foundation of Canada. Face, arms, speech, and time. Is the face drooping? Does it look asymmetrical? Arms, can you raise both arms? Sometimes a person who's having a stroke can only raise one arm. Speech, is their speech slurred? Is it jumbled? Is it not making sense? And time is a very important factor. Call 911, get this person to a hospital immediately, because the quicker you act, the more the person has a chance of a full recovery. So to summarize here, the future of the Oxford AstraZeneca vaccine here in Canada is yet to be determined. It's on pause as of today. Whether this is a full halt, whether this will be the end of the story of Oxford AstraZeneca in Canada, I do not know. This has global ramifications. The Oxford AstraZeneca vaccine is an inexpensive vaccine because they are producing it at cost. It's a vaccine that is accessible to many countries around the world that are low to middle income countries, and they cannot afford the Pfizer or Moderna vaccines. This is really important because we know this pandemic is not over for anyone until it's over for everyone. We really do need to get the pandemic under control in all areas of the globe in order for it not to keep affecting us so detrimentally across the globe. So this is difficult news for Canada, but I expect that this will be difficult news around the world if Canada is taking this position on it, because the likelihood of other countries who are going to follow with the new evidence that has emerged is likely, and it's very difficult to hear this today. It's really unfortunate. Further delays. This will delay Canada's vaccine rollout, which has already had multiple delays. And the longer that we have these delays, the longer the pandemic rolls on, the more the variants spread, and the more difficult this is for everyone. So please continue to follow all public health guidelines, even post-vaccination. We know that the evidence shows that the vaccines take a good 3 to 4 weeks to give you protection. For the first 2 to 3 weeks, there is zero protection from from SARS-CoV-2. So after you've had the vaccine, for the first 2 to 3 weeks, you do not have any protection from this disease, and you need to continue to follow all public health guidelines. And if you are going to socialize, please do not do it indoors. The variants that are circulating in Canada now are much more transmissible. They are much more lethal. They are much more likely to put you in hospital. But one big thing that you can do is you can socialize outdoors. This greatly reduces your risk of contracting the virus. It greatly reduces the level of viral load that you will be exposed to if you are socializing with someone who may have been exposed and may be transmitting this virus. So whenever possible, socialize outdoors, and when it is not possible or when distance is an issue, please do wear a mask and take all public health measures very seriously. So I wanted to bring that news to you today. I know it is not the greatest news, but I thought it was really important to share. One thing that I do want to point out is that this is a sign that our surveillance systems are working, that our regulatory bodies are not in a position where they will not halt a vaccine if they start to see any concerns or any safety issues. This type of surveillance is happening constantly with all vaccines and all medications that are available in Canada. There is a reporting process for any adverse events from medications and any adverse events from all vaccines, even the ones that have been around for 20, 30, 40 years. So this is not unique to the COVID-19 vaccines, but it is a sign that our surveillance processes are working. And I think that in that, even though this information is very unsettling, we do have to have some confidence in these regulatory bodies. So thanks for joining me today. I have a lot of COVID-19 information and studies to share with you as we go on in the future here. But today I wanted to bring this one to you really quickly. Take care and stay healthy. Bye-bye.